Well, today we're keeping you in the know about a medical assistant shortage and how local resources and hospitals and schools, how they're trying to combat this. So today we're joined by Dr. Amber Chapeau of Methodist College. Good morning, Dr. Chapeau.
Good morning.
Or good afternoon, I should say.
Good afternoon.
My times are all getting mixed up in my head. But this sounds like a pretty serious issue here, a medical assistant shortage. So can you talk about the current shortage and how severe is it?
So we actually have a healthcare shortage in general. The American Hospital Association is saying that by 2026 we're going to see about 3 million in shortage across all healthcare sectors. But we're going to see medical assistants about at 115,000 shortage every year.
Wow.
So we're going to need to educate 115,000 medical assistants across the country every year between now and 2026. So it's a shortage and we need to get busy.
Yeah, that's pretty severe. And what are the duties of a medical assistant?
So medical assistants are pretty versatile, actually. They room you. They're the first person that you typically see. Usually they're the person who check you in. They take your information. They are scheduling your appointments. They're taking your vitals. They're doing all the testing, drawing your blood. They can also talk with your insurance companies and make sure that you are able to get any testing that you need. They're doing patient education. And we have seen recently that they're even being utilized in the hospital systems for patient education and for vitals there as well.
So they do quite a lot. They're pretty important.
They're pretty important, and they're becoming even more important as we see the change in our healthcare system and the shortage of nurses as well.
Right, absolutely. And are there ways for current medical assistants to grow in their field?
Absolutely. So we do have some medical assistants who aren't certified, and so Methodist is actually offering a Pathways program for medical assistants who aren't currently certified. In that program, we are offering currently a 12-week program where they can come in, kind of be refreshed, because not all of them do all of the things.
Right.
So that allows them to get prepped to take the national certification exam, and we help them get prepared for that and help them set up the test. So we are doing that. Once they are certified, there are ways to come back into other programs. They can do the health science program where they then could move on to be an office manager. They could do the social work program if they decide that maybe they want to go in a different direction. Maybe they want to work in behavioral health because, you know, again, that's another area where there's a huge shortage.
Right.
And we have a social work program. They could also come back and become a nurse because nursing is another area where there is a huge shortage.
Right.
So there's lots of opportunities for medical assistants to grow their career. It's also a great career to stay if you want to stay in that position and grow in that area as well.
Right. So lots of different routes to take.
Absolutely.
Lots of different journeys. Well, that's great. And what else is the college doing to combat the shortage in our area?
So we've recently actually shortened our program, made it a hybrid program where they are allowed to still work and then maybe do their classes online in the evening where they just do a Teams meeting with the instructor. And then we do clinicals on the weekends. So it kind of creates a good balance for work, life, school.
Right.
We also do more flexible scheduling. We have smaller class sizes, so there's a really nice relationship with the instructors and the students. So we get to really know you personally and get to really kind of feel it out and make sure that you're getting one-on-one attention. We've also just lowered our tuition rates within the last year for our medical assisting program. So many opportunities for growth, and we're one of the most economical choices for a medical assisting program in the area at this point.
Well, that's great. Sounds like you all are doing all you can do to get those numbers back up. So
we're trying really hard.
Yeah. Hopefully we can get those numbers back up.
We sure hope so.
Yeah. Well, thank you.
We need to get them out in the field.
Yes, absolutely. Well, thank you so much, Dr. Chapeau, for coming in this morning.
Thank you for having me.
Of course. And you can check out this interview on our website, 25newsnow.com. You can also, if you want to join us here on In the Know, you can click on the Features tab and fill out the In the Know form there, and we will take a look at it. And we hope to see you on In the Know joining us in just a bit. For now, stick with us. We'll be right back.